Good morning, friends. Let's have a short discussion about the importance of basal implants in atrophic, resorbed maxilla and mandible. We consider in implant dentistry now that the basal implants are the assets for the atrophied maxilla and mandible. Okay, why I'll explain in brief. When you come across a patient, age patient of about 60 to 80 years, if the patient is using dentures for more than two terms or two sets of dentures, that kind of patients will walk into your clinic and ask for something permanent because they are irritated or otherwise they are fed up of using ill-fitting dentures. So what happens after usage of two set of dentures? The maxilla and mandible will be resorbed. Okay, so you're going to try to make another set of dentures, so they won't get retention and stability, and the patient will not be happy also. In such cases, you have to plan the patient for something fixed. So what is fixed? What you're going to do? So the first step is to go for the radiographs, that is CBCT or OPG. So you have to evaluate the available bone in both CBCT as well as OPG. So depending upon your evaluation and treatment plan, you're going to give something fixed for the patient. So when the patient's maxilla and mandible are resorbed and atrophied, you cannot give conventional implants. Conventional implants can be given when there is a good cancellous bone, that is a trabecular bone. So beyond that, you can go up to 3 to 4 length more distance of conventional implants. When there is an atrophy in the maxilla and mandible, you need some kind of implants where you can engage such implants in the cortical bone. Where the cortical bone is available? The cortical bone is available below the cancellous bone. In the mandible as well as in the maxilla, cortical bone, bicortical bone also we call it as. Okay, this bone is available in the nasal floor, in the lower border of the mandible, in the maxilla, as well as the anterior mandible as well as the posterior mandible. You can get these cortical bone in the pterygoid plates. So you can get the good cortical bone in the zygomatic arches. So these are the infection-free bone. That is, this where the cortical bone is available, this bone will not disintegrate. It will not resorb. It will stay for a long time. Even after the death of the patient, the cortical bone will stay. It's an infection-free zone. The cortical bone zone is an infection-free zone. So here we have to engage the implants. So for atrophies maxilla and mandible, so conventional technique will not hold good unless if they have come up with lengthy implants to place in the corticals. So in cortical implantology, in the basal implantology, we have such a design and a length of implants where we can engage such cortical implants in the cortical bone. Okay, so this method of engaging these implants in the cortical bone, we call it as osteofixation. Here we don't consider the osseointegration. We won't wait for the osseointegration to happen, for the modeling process to happen between your implant and the bone surface. Here we call it as osteofixation. Through the process of osteofixation, the implant will engage in the cortical bone, and after the placement of the implants, you can immediately load the implants. Means you can immediately functional loading of the implant can be done. Immediate functional loading means you will going to give the processes for that particular patient. The processes may be the temporary processes, or if the stability and anchorage is too good, you can go for the permanent functional loading of the implants. Okay, in full mouth cases, or even in the partially dentulous cases also, you can go for permanent functional loading if your implants have good torque and stability and anchorage. Okay, so what I was explaining was the basal implants are the assets in atrophic maxilla and mandible, and that is true because we can engage these basal implants in the deep cortical bone, which is that area is free of infection. It's an infection-free zone. That is the cortical bone or the basal bone. So, and also it will not disintegrate or resorb. So it's an asset only. So basal implants are assets for the atrophic maxilla and mandible. In full mouth cases, especially when the patient is aged between 60 and 80 years and they have used set of dentures, are not happy with the another set of dentures, go for the immediate loading after the placement of the basal implants in the atrophic maxilla and mandible. So we can give another life inspiration for the patient to live by giving these implants, and with the immediate functional loading the patient can start biting on the processes. Okay, so again I'll tell you, the basal implants are an asset for the atrophic maxilla and mandible, and you can give the functional loading and processes for the ACE patient. Thereafter they will live happily. Thank you.